Hello, my name is David Trimberger and I am answering the Module 4 question 1. In this discussion, it is asking for the management difference for managing a patient that is in a postictal state and a status epilepticus state. Sorry, I struggle pronouncing those. So to start off, if someone is in status epilepticus, that's meaning that they're having a single seizure that you are able to observe that is lasting longer than 30 minutes, or they're having multiple seizures back to back without waking up in between. Both of those requires management, and the way that you would manage this type of patient is you're going to treat with a benzodiazepine, such as Ativan, Versed, or Valium. And your goal is you are trying to slow down nervous transmission in order to give the brain a break. So now that you have managed your patient, the next step that you are going to be having to take care of is dealing with your patient that's in a postictal state. So whenever you're giving a patient a nervous transmission kind of slowdown, some of the biggest things that's going to start to decrease is respiratory rate as well as blood pressure. They're both going to tank. So the first thing that you need to manage is going to be your airways. So either you need to intubate or bag them and make sure that you're getting that respiratory rate back up. And then you also want to try and get the blood pressure up that you would treat with medication or do a fluid bolus, so making sure that you start an IV on them. Then after you have all that taken care of, you're going to want to make sure that you document the position you found the patient in, so whether they were curling in or curling out. You also want to document how long the seizure was lasting. That way the hospital can be able to better treat the patient properly. And then you're going to monitor and keep on making sure that you keep that blood pressure and respiratory rate up. If you are struggling to keep those up, then something that you can do is you can give an antidote if the medication that you used was a benzodiazepine. So an antidote that could be used for that is known as romazicon, but you want to make sure that whenever you are giving that type of antidote, that you have a different form of nervous transmission slowdown, such as a barbiturate or a hydratoin. You want to make sure that you have those on board, because once you administer that romazicon, that it's an antidote to benzo, and it's going to cause it to act more of sorry, let me rephrase that. So if you give a benzodiazepine and then you also give romazicon, you can't give benzodiazepine again, because the romazicon is still going to be staying in their system and it wouldn't be able to function properly if you re-administer a benzodiazepine. So it's not going to be able to work. So it could just, ergo, cause your patient to go back into a seizure. But once you have all this is done and your patient begins to start waking up, you're going to want to make sure that you can redo AVPUS and see if you can possibly help reorient them and help kind of get their brain turned back on. Thank you for listening. That was my response.